welcome to everyone that's with us this evening. To the candidates that have come, we're still going to add a couple more people that aren't on just yet. But we wanted to let you know a little bit about who we are. We're NAMI Greater Houston, and we cover Harris, Fort Bend, and Montgomery counties. So we're a very large affiliate. And so we would have people from multiple districts, and we will let you meet them as our moderator, Jane Malin. Dr. Malin is really moderating tonight, even though she's the president of NAMI Greater Houston affiliate, and I'm the vice president. The purpose of our dialogues was to give the members of our organization a chance to hear from candidates who about mental health, and maybe to do some educating about what we as families actually are concerned about, especially because there are so many issues. You know, we think of that mental illness affects 1 in 5 people, but what we don't realize is all the other people that are affected, because it's not just that one person, it's their family, it's their friends, it's the people they come in contact with. So even though it may seem like 1 in 5, it's really probably about 3 out of 5 or 4 out of 5 people that could be impacted by mental illness. So we wanted to be sure you were aware of just how broad a range it is. And of course, given our current pandemic, it's really affecting folks because, as you know, if you know anything about trauma, every time you go through another trauma, it creates more anxiety and more depression. And for people who haven't experienced trauma and may not in their lives have experienced it, this part in time is really something for them to deal with. And so we're seeing more people with anxiety, more people with depression, and of course, those people who have and live with a serious mental illness, and we call them survivors, by the way, they are people first, though, and we owe them a great debt. And so we, as the family members and friends and individuals with mental illness, are here tonight to really just kind of have a dialogue with you to talk about what the needs of the families are, what the needs of the individuals are, and to hear from you some of your ideas as well. So we're going to go through this. We've got some time limits over. I just want to thank everyone who's on with us through Facebook Live, as well as those of you that are on with Zoom. We thank you so much for being willing to spend some time with us. So I'll turn it over to Jane.
Okay, welcome. We have a national campaign called Vote for Mental Health. And so that's the theme tonight. This is a chance for our members and friends to hear from the candidates. And we thank you so much for participating. We will be having statements, opening and closing, and we'll be taking questions from our participants. The chat box, which is available both on Zoom and on Facebook, is where you can put your questions in so that that I'll be able to convey those to our speakers, our presenters. We're still waiting for 2 more folks from District 11, but we have Jay Stittelberg from District 14 and Melinda Morris from District 13. Thank you. We invited both incumbents and challengers. There are 3 candidates in many of these districts because there's a libertarian candidate also. So in District 4, there is Brandon Creighton, there's Jay Stittelberg, who's with us, and Cameron Brock. In District 13, we have Dr. Melinda Morris. The other candidates are Boris Miles and Richard Andrews. And we're delighted to have you tonight. Let's see, I think we're good. Each of you will be given 2 minutes to introduce yourselves and tell us why you're running for the office. Say some things about mental health too while you're at it, and we'll go from there. So we'll start with District 4, Jay Stittelberg. This district covers a lot of geography from Montgomery County, Conroe, over to Winnie and Port Arthur. So it's a big district, and we're excited to hear from you, Jay.
Well, good evening. Thank you, Jane. I appreciate the introduction. Good evening, everybody. My name, excuse me, my name is Jay Stittelberg. I'm an Iraq War veteran. I'm a graduate of the United States Naval Academy. I served as a submarine warfare officer for over 10 years. Hold on
just a minute. Let me ask Jessica. Can you put the speakers in the full screen? I'd like to see Jay even better. Great.
There I am.
There you are.
All right. Again, thank you, everybody. My name is Jay Stittelberg. I'm an Iraq War veteran, a graduate of the United States Naval Academy, and I served as a submarine warfare officer in the Navy for over 10 years. And I currently work as a project manager in the oil and gas industry, consulting owner-operators of oil, gas, and petrochemical facilities on OSHA, EPA, and Department of Homeland Security regulatory compliance. And the reason I'm running for Senate District 4 is because I've lived in Texas now for 13 years. I moved here when I got out of the military. And what I have witnessed over that time is that Texas is in the bottom in public education. We're at the top in property tax burden. We're #1 in the nation for the number of rural healthcare clinics and hospitals that have closed. And we're #1 in the nation with the number of uninsured residents we have in the state of Texas. And it's completely unacceptable. And we need to elect leaders to the legislature that have the moral and political courage to take actions to do the right things for the better of Texas and the better of Texans. And that's why I'm running. Just to talk a little bit, I'm so pleased to be here to talk about mental health issues, including suicide prevention. I had a roommate when I was a young enlisted sailor that died by suicide. We've had 8 classmates from the Naval Academy die by suicide since we graduated. Keeping in mind that I graduated in 1998 and every one of us went to war after 2003. So I see mental health issues and suicide on a regular basis, just being a veteran with my friends and people that I don't even know. I also serve on the Montgomery County Behavioral Health and Suicide Prevention Task Force. I sit on 2 of their work groups, the adult and pediatric suicide prevention work group. And I'm the LGBTQ and veteran outreach lead for those 2 groups. And you heard about the district layout. Senate District 4 goes from 105 in northern Montgomery County south through the rest of Montgomery County. It includes Creekside, which is the portion of the Woodlands that's in northern Harris County. And then in eastern Harris County, it goes Kingwood down the eastern edge of Harris County to get into Chambers County. It's all of Chambers County, all of Jefferson County to Beaumont down to Port Arthur, and it includes Bolivar Peninsula in Galveston County. So again, it's a pleasure to be here. Thank you so much for the invitation. I look forward to your questions, and we need to end the stigma around mental health and suicide and make them everyday dinner table conversations. Again, thank you so much. I'm looking forward to the conversation.
Thank you, Jay. It's wonderful to hear what your background is and these concerns you have about mental health and suicide and what you've been doing. Our next.
Oh, she froze.
Okay.
You're fine.
Okay. Which is, here we go, part of Fort Bend and areas of Houston, including Meyerland, Grays Bayou area. Dr. Morris, you can probably tell us a bit more about which ones those are. And we're delighted to hear from you, to introduce yourself and tell us why you're running and a little bit about your mental health concerns.
Well, thank you so much for this opportunity and inviting me to speak tonight.
I'm Dr. Melinda Morris. I'm the Republican nominee for State Senate District 13. I'm a physician of 35 years, obstetrician and gynecologist, and I just retired 6 weeks ago. So I can run for Senate full time. But, during my practice of obstetrics over the last 35 years, I've seen and dealt with many mental health care issues. Postpartum depression is the most common complication of pregnancy. And we can go into more details. I can talk about this topic for several hours if you'd like, but it's definitely a concern for me. I'm a former major in the United States Air Force. I served on the front lines in labor and delivery. So that was my service to my country, and I'm a very proud veteran, and I understand the mental health issues with the veterans as well and their increased risk for suicide. Senate District 13 is a very large district. We start just south of Humble, go all the way 45 into downtown Houston, the medical center, the museum district, down 288 into West Pearland area. It includes the 3rd Ward, the 5th Ward, Sunnyside. It goes out Southwest Freeway, includes the Meyerland, Braeswood areas, Braes Bayou, out to Stafford and Missouri City to Highway 6, down Highway 6 into Fresno, Arcola to Manville. So it includes 2 counties, very large area that we're the most diverse Senate district in the state of Texas. And the reason I'm running is because this district deserves better leadership. It deserves a leader that understands and cares for the residents and will represent all the residents of Senate District 13. So once again, thank you for this opportunity, and I'll be happy to answer any further questions.
Thank you very much, Dr. Morris. We appreciate hearing your background again, which is really relevant to mental health issues. That's really, really wonderful. I'd like to, before we go into the prepared questions, which I think you all got copies of, I'll just select some of those things. I'd like to talk briefly about the sort of the context that we're in right now. NAMI National has a really wonderful strategic plan that includes 3 major goals that we are very interested in here in Houston area. One is that people get the best possible care. And we help in that area with our support groups and our free training, but there is a great deal more that we need to do in the Houston area. Jessica, can you put me on as the major thing? Dr. Morris probably doesn't want to be the, the one on the screen right now.
Or maybe she does. It'd be great. We are recording this for y'all's purposes, so we'll get you a copy of the recordings as well.
Yeah, yeah. Well, hopefully I'll show up on the screen at some point here. The related goal is to help people get help early. We know more and more about how early mental illness is detectable in children and youth. And we also know that it takes over a dozen years for most people to actually get help. Dozen years from onset, which is really shocking and surprising. And it's very important to be able to reach families and schools in order to handle these, to get people started early in treatment, because early treatment actually is good for people. It does work. And thirdly, we want people diverted from the criminal justice system. Unfortunately, given the problems with access, especially in Texas, which is again lowest per capita availability of treatment of all the states, people get their treatment in the criminal justice system because the other system can't accommodate all the people who need help, and they end up in crisis when they should have been treated way before they got into crisis. And so we're very concerned to continue to improve this situation. In Harris County, a lot of progress has been made because we have the specialty courts, and we have a jail diversion system. But we need to keep pushing on this so that we don't have people in jail, which is not a good treatment milieu for people with mental health problems. So going to the questions, the other part of the context, of course, is that we are in a pandemic. And that pandemic has really affected people's mental health. And for that reason, there is actually more demand and will be more demand for mental health services. So we have a health system, mental health being part of regular health, that is stretched very, very thin right now. And people with mental illness are especially vulnerable, and it's especially difficult for them to access treatment. Now, the other context, of course, is that the pandemic has created major budget issues. The pandemic has been draining the state budget, and there's a special budget issue relating to what's called the 1115 waiver. That was a program put in place while we were not participating in Medicaid expansion. This program has been is being phased out. It has been phased out for a while. And now in this coming years that this next legislature will be responsible for, the funding will zero out. And this means that I think it's about 30% of our mental health care capabilities have been paid through this program. And so there's going to be a huge impact on mental health access as a result of the 1115 waiver finally losing all funding. And so that part of the budget is a big gap that will have to be made up. So let's talk about funding. How is the state of Texas going to deal with these issues in a situation where it's already has the lowest level of per capita funding for mental health? Jay, do you want to start?
Sure. Yeah, so I guess, I'll start by saying, we have to recognize too that this coming legislative session in 2021 is going to be really a bear, because number one, the state's revenue income is significantly lower, already projected to be more than $5 billion lower. And we see so many areas within our state budget that have been lacking for years as far as the state appropriately funding. And I'm certainly talking about public education at the top of the list. And they've woefully underfunded public education for years. Last year was a fluke. If anyone thinks last year is setting the tone, I think you're wrong. They did what they did last year because Texans were in an uproar about what was going on, and Texans need to continue to be in an uproar because we need long-term solutions to these problems. And when we talk about mental health, access to mental health care, it has to start with kids. It has to start at a young age, and quite frankly, it has to start within our public education system. We have to provide funding in our public education system for education and availability. for kids to talk to somebody. You know, maybe kids don't want to talk to their parents about certain things, but they might talk to somebody in their adult leadership within their school, especially a psychologist type doctor that can relate some issues with them. You know, kids are interesting folk. You know, they don't always like to talk to the adults about things, but they will talk. And we have to do a better job in the state of Texas, because number one, I've already heard it tonight. Our jail system is our mental health system in the state of Texas, and it's a terror. That's not how we rehabilitate people. That's not how people with mental health issues get rehabilitated. They don't get rehabilitated by sitting in a jail. And I really do commend Harris County for having the mental health courts that they have, and the mental health officers. You know, fortunately, we're fortunate in Montgomery County that we do have a crisis intervention team as part of our Precinct 1 constable's office that serves the entire county. There's 14 officers there that are specifically trained for these mental health issues. So they don't go to arrest people, they go to help people and transport people. And those are the types of things that we talk about, right? This is a good place to kind of talk about ending this conversation, at least the wrong definition of the conversation about defunding police, right? The conversation, it's the wrong word to use anyway. It's not about defunding, it's about reallocating funds. And one of the critical things that I think needs to happen is our law enforcement officers have too much on their shoulders to begin with, especially when it comes to, you know, we want them to be counselors and mental health care providers. That's not what they're trained to do. They're trained to enforce the law and arrest criminals. And
I wanted to, relative to that, it's the DA's office that pushed to make our jail diversion centers operational. The DA's office here in Harris County was getting too many repeat cases that were basically misdemeanors, and they thought it might be better to actually help these people get into treatment, and put together a really remarkable and wonderful jail diversion system in Harris County.
Yeah, so I mean, the point of my conversation at the end here is that, you know, we need to put more funds into resources like the crisis intervention team, trained officers in this case that are specifically trained to deal with mental health issues and suicides, so that when they approach these issues, they understand the repercussions of their actions and how they approach and talk to the person that may be in distress, and try to calm the situation or de-escalate the situation, as opposed to exacerbating the situation and it turning into something we see on the national news. You know, so these are the types of things in the state of Texas we absolutely have to do. I mean, if we look at suicide rates as well, I mean, if we look at the Woodlands has one of the highest pediatric suicide rates in the state. And people would maybe not think that because it's quite an affluent suburb of Houston. But money doesn't matter. Affluency doesn't matter. Being poor doesn't matter. It affects everybody. Doesn't care about those things. What it cares about is getting inside of you and destroying you. And we have to start with the kids to make sure there's access with the kids, and make sure our public education system has funding that allows for that, whether it's education and access. And we also need to make sure that for adults, that number one, we end the stigma around the conversations. We need to make it a normal dinner table conversation to talk about mental health issues and suicide, because saying suicide or talking about mental health is not going to bring one of these situations on. Quite frankly, it might prevent one from coming on. And we certainly need to take care of in our criminal justice system how we deal with folks with mental health issues, and make sure they're getting the care that they deserve and not sitting in a jail getting worse and worse by the day.
Thank you, Jay. We really appreciate those comments. Dr. Morris, would you like to comment?
Yes. Well, mental health care issues, medical issues are one of my primary concerns in going to Austin. With my medical experience, I'll have a lot of knowledge that I can apply to the deficiencies that are there now. Everyone knows that we need to increase medical coverage. There are many patients in Harris County that are not receiving adequate medical care,
Yes.
and especially psychiatric care. I dealt with this on a regular basis. And even with our medical center, even with the Harris Health System, there's still people that cannot find clinics, cannot find access to care. If they do have insurance for whatever reason, no one's accepting their insurance. I mean, there's just so many different reasons for people not receiving adequate care. And in the obstetrical population, it's a big problem. You know, women that have depression will discontinue their medications once they become pregnant because they're concerned about the possible side effects to their baby. And so we deal with a lot of mental health issues during the pregnancy. And we've had several ladies that needed inpatient hospitalization. They had developed severe bipolar, psychotic episodes, and it is very difficult to get a pregnant woman admitted to inpatient psychiatric care. And some of these women would actually stay in the emergency room waiting to be admitted to a hospital for days.
Yeah.
I didn't realize that there was such an extensive problem in obtaining inpatient hospital psychiatric care for patients. And we've got to deal with these issues. And I did have to sign several court orders on some patients because they were both a risk to themselves and the child they were carrying. So managing psychiatric problems for obstetrical patients is a big issue and a big concern. And 30% of the Texas economy goes towards healthcare. So it's already an exorbitant cost for the state. And now with the COVID-19 pandemic, those additional expenses, the budget for legislation next year is going to be a huge challenge, and the need for increased access of care. But this has to be balanced as well with dealing with the abuse, waste, and fraud in the Medicaid system. And I don't know that that's being adequately addressed, but we need to do that. There are millions of dollars being wasted through abuse and fraud of the system. So in the need to increase the care for people, there's definitely that need, but at the same time, the legislation is going to have to be responsible and try to balance this increase in costs by addressing the waste and the abuse issues in the system as well. And, you know, unless you've dealt with this medical system on a daily basis and seen the different types of waste and abuse that occurs, you don't even know how to address that problem. But this is going to be a serious, serious issue for our legislation next year.
Mm-hmm. Well, thank you. So you see the need for more insurance. You see the need for more money for this purpose. What kind of sources do you see for that money?
Well, and that's going to be a challenge, is to find the sources for those monies. And I definitely do not want the taxpayers, the property owners, to bear the burden of these expenses. We can't afford to have people taxed out of their homes to manage medical care costs. And, you know, sometimes there's a consideration for the sales tax to be considered for some of these costs. But there's been a, you know, decline in sales tax revenue. So these are going to be really big issues that we're going to have to look at and address. And it's going to take a lot of common sense and a lot of knowledge of the system to be able to correctly address these issues.
Would you pressure the governor to accept federal funding for Medicaid eligibility for low-wage adults?
Well, that might be a possible consideration. We've also got to get better coverage from the private insurance companies. We've got to control the cost of big pharmacy. We've got to make medical billing transparent so that people can actually shop for the best prices. You know, they're keeping a lot of secrets on, you know, what they're going to charge. Then you get this billing that you never even knew you were going to get. It would be like buying a car, but they're not going to tell you how much it costs until you get the bill 3 months down the road. So we need to open up the insurances to open markets across state lines and let the consumers drive the market and get the best prices for their medical care. And, you know, a lot of insurance policies don't include mental health care coverage.
Yes.
And we've got to pressure the insurance companies to provide adequate mental health care coverage in addition to the medical coverage.
Jay, would you comment on sources of funding? Thank you, Dr.
You
Morris.
know, obviously, I said before, the state has a revenue problem coming in anyway, and that was, you know, quite frankly, that was, you know, it's not solely due to COVID. COVID has not helped by any stretch of the means, but in general, hold on, sorry. Trying to manage my animals while I'm doing it. But COVID wasn't the sole source of us having revenue problems at the state level. The states had revenue problems for a long time. They might not like to admit it, and they might like to make everybody think that the budget's balanced every year and they're fine with money and everything's great. Look at the smile on my face. But unfortunately, when you dig into it, it's actually not true. So when we look at funding sources or revenue sources, number one, we have to close the tax loopholes that we have in this state that give corporations billions and billions of dollars a year, on the order of 5.4 billions of dollars a year, by the way. That's in the Equal and Uniform Act. Every single year. And the Equal and Uniform Act is a great policy. It was a great piece of legislation to help homeowners so that we could contest our appraised value of our homes, which directly contributes to how much we pay in property taxes. The unfortunate unintended consequence of that is where the corporations take control, and they can afford to hire their bank of lawyers and go to court with these equal and uniform cases. And in 2017, there were 12,000 cases filed in the state of Texas. About 1,000 of those were regular homeowners like you and me. The other 11,000, those were corporations, and the appraisal districts can't afford to take all these people to court and fight it in court, so they don't, so they just give in. And so that has allowed corporations to basically pocket $5.5 billion a year on the backs of hardworking Texans. And we also have to recognize that we have a franchise tax in the state of Texas, and it hasn't changed with the economy in Texas for years and years, which gives another $3.5 billion away. So when we have to look at ways to increase the revenue in this state and look at ways that it's not going to impact the everyday hardworking Texan that's a homeowner. And by the way, you know, people think that if you rent, you don't have anything to do with property taxes. Well, by the way, part of your rent goes to those property taxes. So if the property taxes continue to go up, your rent's going to go up because the landlord's not going to pay it. I can tell you that right now. So you do have a vested interest in property taxes, even if you rent an apartment. And so we have to look at these things, and these are difficult things, right? They're not easy. And Austin has known about these things for years and years and years, and they refuse to close them, mostly because lobbyists come in and say, I'll destroy you if you try to do this. And it's something I just wouldn't tolerate if I get elected to this office, because it's about helping Texans. You know, we got to have people before corporations. I understand the difference between a small business owner and a corporation that has millions and billions of dollars. I understand the difference, and we need to define that difference when we write legislation to protect the small business and make sure that big business is paying their fair share, because right now they're certainly not. So these are the types of things we have to look at. Number one, we have to expand Medicaid in the state of Texas. There's just no question in my mind. We're one of only 13 states that haven't done it. And we've seen the data on the states that have done it. And here's about what's going to happen, right? It would cost the state about $5.6 billion to expand Medicaid. It's a lot of money, I get it. But what's our return on investment for that? Our return on investment from that is over $65 billion from the federal government. So that's a 1,700% return on investment. That's pretty darn good if you like numbers. And that's going to help keep our rural healthcare clinics and hospitals open, so those people that live in rural areas have access and they don't have to get in a car and drive for 4.5 hours to get healthcare. And not to mention, they can get mental health healthcare in their own backyard instead of having to drive again 4 hours to get something. And not to mention the uncompensated healthcare costs that go on in this state. People have to recognize when, you know, I said at the beginning, we're #1 in the country in the number of uninsured residents we have, over 4.5 million Texans. Medicaid expansion would give 1.6 million Texans that have nothing right now health insurance. It would give them access to health care. And not because those folks right now, they get sick, they go to the emergency room. Well, first they don't go anywhere. They get sicker and sicker. And when they finally can't take it anymore, they go to the emergency room for their care. They can't afford it. They're not going to pay for it because they can't afford it, but somebody's going to pay for it, and it's usually us. So the other advantage of Medicaid expansion is it's going to reduce that uncompensated healthcare costs by over $35 billion. These are B's, billion. You know, I just don't see why there's an argument of this other than political crap, pardon my French, of why they won't do it. It just, I mean, the data just screams that it makes sense to do it. Red states have done it. By the way, Texas isn't a red state anyway. It's a non-voting state. We really have to change that. But at the end of the day, it just doesn't make sense not to do it. It's our money. Why don't we get it? Why don't we help Texans? And that's just simply not what we're doing right now.
I'd like to let you know that NAMI Greater Houston has sent a letter to the governor, probably at least a month ago, urging him to accept the federal funding for Medicaid expansion. Arguments that you've talked about, and it's clear that we can get a lot for that, and we actually, because of our budget situation, we need it. We need that money badly.
Well, and we're recognizing with the coronavirus that having your health insurance attached to your work is not the best, is not
so great.
Plan, right? I mean, I've been saying for years that we need to take the problems that we know exist with the Affordable Care Act and fix them. Congress has the ability to do that. They need to do it. They need to fix those problems, right? Because that's going to start reducing our health insurance costs. And then we need to hold pharmaceutical companies. I know the doctor talked about that. The pharmaceutical companies are ripping us off left and right every single day, and it's killing people in America. And we have to take action and hold them accountable. And insurance companies, the same thing, right? We like to talk about a free market, but we sure make it awful hard for us to have a free market with insurance the way we handle the insurance industry in this country. And it's just shameful. I mean, I have relatives that live all over the world, and they're in all kinds of different healthcare systems. And most of them are socialized in Germany or Canada. And yeah, I mean, there's no perfect answer for healthcare in this country. Any country, there isn't. And they have their issues too under socialized medicine. But we have to fix the system we have because, you know, I'm a Democrat, but I will say this right now, I believe, you know, if people want universal health care, I get it. I understand it. I don't unbelieve it. But here's my question and challenge. My challenge is in those countries that have it, those healthcare systems are non-profit, not-for-profit healthcare systems. A very small percentage of their systems are for-profit, and it's mostly procedures, elective procedures, like if you want to have something done, not critical healthcare. The majority of their healthcare is not for profit. So how do you take an industry like we have in the United States that's for profit, turn it nonprofit, and not lose millions and millions and millions of jobs in the process of doing it? It just cannot be done like that overnight. So we have a system that we've had for years. We know what's wrong with it. Let's fix it. Let's make it better. And then watch what it does, and let's fix it again and make it better than that. And let's hold these big companies, pharmaceutical companies, accountable. And let's make health insurance have choices that'll reduce the cost. I mean, how hard is this for these people in Washington that like to just run around in circles and do absolutely nothing for us in America?
Let's take a question from the listeners. What is your opinion on insurance companies buying nationwide pharmacies, such as Aetna buying CVS? Dr. Morris, do you want to take that one?
I think that's a total conflict of interest. Actually, I can't believe it's legal for them to do that. When I found out that CVS had bought Aetna, and now they're putting in their own clinics, so they're basically creating a little monopoly for themselves. I mean, if you have Aetna insurance, you're going to have to go to CVS, to their little mini clinics that are staffed by nurse practitioners to get your initial care. And then when they write you a prescription, you'll get that filled at CVS. So they've actually created a little medical monopoly for themselves, and I can't believe that this is legal to do. And this is just another way that insurance companies and big pharma have taken over the management of medical care. And this issue needs to be addressed.
Thank you, Dr. Morris. I have another question here. Where is it? Where is it? Hold on. From Tina Grace, Bartel Kadka. Yeah, she says we need long-term solutions and it has to start with childhood. And I would like to bounce off that question and add a little more to it. In juvenile criminal justice, about 70% of youth have a diagnosed mental illness. And in suicide prevention, suicide is the second leading cause of death among people aged 10 to 34. What do you see about how this sort of problem can be dealt with in the children and youth of Texas, especially as it relates to suicide prevention? Do you want to start, Dr. Morris?
Well, you know, we need to have counseling available in the schools. I agree with Jay. Many times children will discuss things with their school counselors that they would never discuss at home. And I think that's where, you know, if they can discuss it in the families, that's great. But many times, sometimes the family's part of the problem. And so these children need counselors available to them. So I think each school needs to have a psychologist available, a child psychologist that's available for counseling. You know, teachers are usually aware if a child is showing signs or problems. And as soon as that's recognized, they need to get in for counseling, for evaluation. The earlier intervention, you know, occurs, the better the health for the child. And the sooner the entry into treatment, the better they're going to do long term. And it's when things are ignored, not discussed, that it escalates to the point of someone considering to take their own life. And we've got to provide this for our children.
Thank you. Hey, would you like to say something about early intervention for suicide?
Yeah, I mean, you know, I agree with the doctor. I mean, you know, these are such critical issues, and we have to start interjecting at an early age, because the earlier that we can approach and start treating some of these kids, the long-term benefits they're going to have, in my opinion, far outweigh any, you know, backlash that would come from you know, instituting a policy like this. Because right now we kind of leave our kids out to dangle, quite frankly, if they're having issues. If you know, if you have parents that are not necessarily engaged fully in their kids' life, and believe me, some people may not believe it, but there are a lot of children whose parents are not integral in their lives. They're not ingrained in their lives. So when these kids go to school, that's when they actually get to interact with folks, and especially with adults within the school, whether it's a teacher or whether it's a counselor or whether it's a you know, an athlete and his coach. You know, that interaction is critical, because that's how they are going to progress, and that's how they're going to grow, and that's how they learn. And when they're not getting that at home, they have to get it somewhere. And that's why, you know, right now in the world of coronavirus, that's one of the most difficult things about, you know, schools not being able to open fully and doing remote learning. Not only because the kids don't necessarily have that interaction, but if they're in a house where they don't have that interaction with their parents, it makes it even worse. You know, and of course, then if their parents aren't engaged, And maybe there's cyberbullying going on, because we know that exists. And that's making the assumption that that child that's in a household like that has access to the internet and technology to be able to be even engaged with what's going on outside their house. So, you know, it is critical that, you know, we have these resources available for kids at a young age so that we can act. And we all know that if we don't do that, the ultimate result is suicidal ideology and death by suicide. That's how this ends. And that's, unfortunately, that's not pretty, but that doesn't matter. We have to talk about it, because that's what happens if these kids get put in these positions, right? And it's not just things like bullying that come into play. I mean, parents not being engaged. Okay, bullying is involved. Food insecurity. I mean, what if the food they got was their meal they get at school, and while they're home now and not going to school, they're not eating a regular meal every day. And social injustice and economic injustice. All these things play. When we look at the highest risk groups when it comes to suicide, especially at the youth level, you know, we're talking about Black children, we're talking about LGBTQ children, you know, and quite frankly, you know, you could even, veterans are obviously not children. Veterans are at the high end, but if a veteran has children, as far as I'm concerned, that's part of that veteran community, because it's in the household. And so if that veteran has these issues that they're dealing with, and maybe they turn in, you know, unfortunately, because of their circumstance or their mental health issue they have, they turn into a parent that's not engaged with their children, and they fall into these same categories. And these are the ones at the highest risk. So there's so many things we can do as counties, as local governments, as state governments, as national or federal governments, that we can do to start addressing these issues and helping improve access to mental health care, which is in and of itself going to reduce the suicide rates that are going on. Because if people get engaged early, the likelihood that they're going to die by suicide is significantly decreased. And we just have to recognize that and take actions and make sure we're spending your tax dollars in the right places when it comes to allocating funds that come in, whether it's the county level, the state level, or the federal level.
I wanted to say that Neil has said something that I really agree with in the chat, which is that this mental health issues are clearly bipartisan. That Jay and Dr. Morris can work together on this one. There are a lot of common ideas, commonalities, and that's very exciting. That's been true for quite a while, that mental health issues are bipartisan issues. I'd like to close the questions now and ask each of you to go ahead and make a closing statement. Just a minute, you know, not much, but we'd love to hear it. Dr. Morris?
All right, well, thank you so much. And this has been a wonderful discussion, and I'd love to continue this on a regular basis. We need to continue to discuss these issues and discuss what we can do. It's costing the state of Texas a lot more money by not providing adequate health care than it would cost by providing adequate health care.
Yes.
I can promise you that I have patients that return on a weekly basis to a hospital that is an exorbitant cost because they cannot find a clinic where they can go for follow-up. And when we talk about the youth, you know, we didn't address the drug issue, but psychiatric problems, sometimes if these children, you know, can't receive any counseling or help, they start self-medicating. And this leads to drug abuse, unhealthy lifestyles, and eventually to suicide and death. So we've got to take care of our young children, and it's got to start at an early age. And this is my passion for wanting to run for state senate. I know with my 35 years of medical experience that I can contribute significantly to try to solve the problems that we're dealing with. the financial issues, the medical issues, the increased access to medical care and mental health care. And I hope that Harris County Senate District 13 will give me a chance. I'm the first Republican to run in this race for 20. And so Senate District 13 has a choice in this election. And if you want to know more about me, you can go to my website at www.Melinda, and that's with 2 I's, Melinda Morris for Texas Senate. You can call me at any time at 832-413-2585. I'm a doctor. I'm used to being called at all hours of the day, so you can get a hold of me. And I'll be glad to discuss any of these issues further with you or answer any questions that you have about my campaign. But thank you very much for this opportunity tonight.
Thank you so much, Melinda. Okay, Jay.
Yeah, well, you know, I will say this to start this, that, you know, doing this tonight is exactly why I'm running for the state Senate, because you just sat and watched Dr. Morris and I have a civil conversation and agree on many more things than we ever disagree on, especially when it comes to this topic. And I tell people every single day, you need to vote for candidates and not parties, because at the end of the day, you know, when you straight ticket vote, no matter which side, I know straight ticket voting is gone, but you can still do it. You just have to scroll down the ballot and do it. But when you blindly vote for people just because of the letter after their name, I guarantee there's somebody on that list that doesn't have the same values you do, and doesn't have the same issues at heart as you do. And I know that compromise has been lost in our political environment. They don't have the ability, we just simply don't seem to have the ability to do it. I remember Tip O'Neill and Ronald Reagan, and I remember Bill Clinton and Newt Gingrich, diametrically opposed politically, but they sat at the table, they hammered out their issues, and they created legislation that worked. And that is something we're missing today. And I know very well that when I can sit and talk to somebody that's a Republican across the aisle, much like tonight with Dr. Morris, we have much more in common than we have differences when we actually sit and talk to each other civilly. And I know absolutely that's true. I don't choose my friends because of what political party they're associated with. I mean, I work in oil and gas and I'm a veteran. I was in the military. So I have lots of friends that are Republicans, and I choose them to be my friends because of their character and because of their actions and because of how they treat people. I don't choose them because of the letter after their name. Because believe me, I know many people with a D after their name that I don't associate with because we do not have enough in common to do that. And we just need to spread that word that it's so important that we talk to people. And when we can disagree on policy issues. That's what America is about. But we don't have to degrade people. We can sit and have civil conversations, and we all want what's best for America. None of us are communists. None of us want to turn America into China. What we want is a fair and balanced system that gives everybody, no matter the color of your skin, the religion you decide to practice or not practice, whether you're gay or straight, it doesn't matter. Everyone should be on a fair playing field and have an equal opportunity to make whatever they want out of their lives. And that is why I run. This public service is a passion of mine. My career is in oil and gas. My passion is public service. And that's why I continue to run. And Dr. Morris, I can certainly relate to you because I'm the first Democrat to run for this seat in nearly 20 years. My last race, I was the first Democrat to run for county judge in Montgomery County in 30 years. And I know that these districts like this are an uphill battle, but it's so important that we have good qualified candidates on the ticket in every race that creates choice for everybody that lives in that district to choose who they want to represent them. And I certainly hope that you all will give me a chance and support my campaign. And if you do want to learn more about me, my website is jstittelberg.com. You can follow me on all social media, Facebook, Twitter, and Instagram. And if you have any questions, you can send me an email through my campaign website, and I will answer any question you have on any topic, and I'll be very straightforward with you. So thank you so much again for inviting me. I always enjoy these. We need to do them much more often, and quite frankly, they need to be on the TV. So that everybody can see them, so that we can end the stigma and do what's right for Texans.
Thank you, Jay. Thank you both. This has been a wonderful evening. We really appreciate it. I'm going to hand it over to Brenda.
All right. I can't say thank you enough to both Jay and to Dr. Morris. I think this has been one evening where we can say that definitely we've gotten the best of both worlds. You know, we really appreciate all that you have done. We appreciate how you've been so straightforward with us and so transparent. So I can only say thank you to both of you. And certainly we are not partisan. We are interested in people who do, like you say, are interested in promoting the care of individuals with serious mental illness. We will ask Jessica if you can put up our warm line. We do have a warm line that people can reach us, and we take more calls than even the Harris Center on our warm line. And we want to be sure that people are aware that we do have a way for folks to call and talk to individuals to help them if they at this point are feeling anxious. There it is. That's our partnership with the Baygood Foundation. Some of you probably know Baygood Foundation, but there it is. And it shows all of the information there. You can get this off of our website. And if you want anyone who's listening or participating, if you want more information, go to NAMI greaterhouston.org and you can see this and you can get more information about whether or not your family member or person is in an emerging unwellness, unwell, or in crisis, to help you know exactly how to navigate for them. And we've got the names of the centers and how to reach both our C Center as well as the Harris Center. So at the end of the evening, and it goes on into other services that you can access as well. But at the end of the evening, we should also say thank you to the Harris Center that has really helped us in many ways. And we actually have our offices there. And of course, I will have to take a minute to say thank you to WellPath for having allowed me to do a lot of work and all of the supporting everything that we do with NAMI Greater Houston. So with that, I'll say good evening to everyone. Thank you so much for coming. And we look forward to having more conversation with both you, both Jay and Melinda. We kind of feel like you're family now. So we will definitely be out there supporting what you do. Thank you so much and good evening to everybody.
And we have 2 more forums next week, Wednesday
Yes.
and Thursday night.
Wednesday and Thursday nights. And Thursday night, of course, we will have the DA Harris County, both Kim Ogg and her opponent, as well as we will have another special guest that we'll talk about then. So thank you.
Thank you.
Okay. Bye-bye.
Very, very much appreciate you joining us.
Really appreciate it.
Elevating the dialogue. Thank you.
Thank you.
My pleasure.
Thank you.
Okay.
Thank you.
All right.